You're doing speaking advertisement, na? Who is doing speaking? Speaking? Speaking you're doing or you're doing? Okay. So not that advertisement. This you're doing speaking advertisement, na? You can take them and post in all the groups. And then who is doing speaking? Speaking? Speaking you're doing or you're doing? Finish the last speaking session. Anybody is there? That is 2 people. Yeah, they are serious, eh? We understand the intensity. If I am working here, then people will come like that. If I am not working here, nobody will come. Okay? You go to a hotel and sit there, but if food is there, then only they will come, no? They'll pay the money, otherwise money will not come. That's it. Okay? Yeah.
Start, sir.
Yes, you can start. Preeti Sehrawat, you can start now.
Good evening.
Good evening, nurse.
My name is Preeti, and I'm one of the registered nurses who is working in the community health center. Please be seated.
Thank you very much, nurse.
Okay. And so, may I know what brings you here today?
Actually, I came here regarding my son. He is just 6 years old. Okay, naughty little John. He cut his finger, you know. It's bleeding freely, profusely. And yeah, that's a big problem. You know, the finger won't stop bleeding. And actually, I was in the kitchen and I left my kitchen knife there on the bench. And he started playing with that and he hurt his finger. I'm very much worried, nurse. Can you please help me?
Yeah, as I see, you are anxious as well as you are worried about your son condition. But don't be worried about and don't be worried. So, can you please tell me, as I see that your child, Mr. John finger is bleeding right now, and before moving further, I would like to ask you some question, and after that, I assess his finger. Okay. And so, can you please tell me about can you please tell me about what was happened at that time? Can you please tell me in your own words for the better understanding and find out the exact diagnose for and give proper treatment according to your statement?
Yeah. Actually, the thing is, you know, I am worried about his cut. You know, it looks very deep and I think it's painful. It's bleeding too much. Shouldn't my son have stitches, nurse?
I can totally understand your concern, but don't be alarmed. First of all, please be calm and take a deep breath. I can totally understand being a mother. It's a very difficult situation for you. Your son is suffering from pain, and you cannot help him. So and right now I am assessing his finger, how much is deep, and how much that cut is deep, as well as after that I can assess that this is a serious or mild cut. And one more thing, and according to my assessment, there is not a serious cut. This is not a serious issue. This is a mild cut. and there is a no need of stitches. Okay.
Okay, nurse.
One
And
more thing you are,
I am
yeah.
anxious and I'm uncertain how long the finger will take to heal, and will it be scarred for a long time. I want to know when my son, who is right-handed, will be able to use this hand properly again.
See, Mr. Martin, don't be so first of all think that that cut is not that cut is not a deep layer, but it will take some time, at least for 1 month, because that children immunity are very low according to adults. So that's why it will take some time, as well as I mentioned you before, that it is a not there is a no stitches is necessary are necessary, but make sure that you can take some precautions as well as take antibiotics also. It will this kind of treatment will recovery better, as well as that recovery period will be reduced and he will get better. Okay. And as you told me about that, you are worrying about that your children fingers shape and size. So there is a no need of there is no change of there is no change of the finger shape and size, because it's a minor cut. Okay.
Okay, nurse, what
Now,
to do about my son's
um,
fingers? Can you give me some suggestions? He is a right-handed person. So when will he be able to use his hand properly again?
he definitely he will use his right hand before and but before that before he will you may be try to avoid his right hand, like try to avoid he is not use his right hand in the running water. Okay. And try to avoid some things, like he not he you can also avoid he don't use in dirty space that hand, because it may be a chances of occurring the infection also. Okay.
Okay, nurse. And
And
if the question of responsibility comes, if the question of responsibility for the injury comes up, I am very defensive. I am a very busy person and I can't spend every minute of my day watching him.
yeah, I can totally understand. You are a working woman, as well as you have no time to always stay with your children. For this time, you can avoid some sharp instrument like knife and anything else like scissor. These kind of things you can keep that things on the safe spaces, like in covered, and use some lockers, and rather than to use in exposure area. Okay.
Yes,
And
nurse.
how one more thing I would like to tell you, that you can take a dressing in at your home also, and like you can use clean the area with a normal saline, as well as you can use apply like betadine, it 10% solution. And you also put the bandage and put the bandage on his finger after that, and don't be try to I mean pressure bandage, because he needs some space also for healing the purpose. Okay.
Okay. Yeah,
And
definitely. Definitely,
yeah,
nurse.
and try to change his dressing every 2 days. If you are not if you have no time at that time, you come, please come to here, I will do this. Okay.
Okay. Yeah, that's very nice.
If
Thank you very much, nurse. I'm going
if
to
you
take all the necessary measures. I'll follow all your suggestions. Thank you once again. Have a nice day.
Okay, thank you.
Is there anything else that you want to tell me, nurse?
Yeah, if you have one more thing, I would like to suggest you. I am take. Can you please tell me about his immunization schedule? He's taking all he's taken already. Sorry, he has taken already a tetanus injection in the immunization schedule or not?
Yeah, of course. You're absolutely right,
Uh,
Nurse.
okay, thanks for this confirmation because this information is very useful for me. Okay, and one more thing, this kind of tetanus injection prevent to prevent to infection also. Okay.
नहीं बोला. Okay.
Uh, okay. If I hope so, I clear your old. I hope so. I
एक
clear
minute.
your old doubt. If you have any other concern, please let me know. I'm here for you, and thank you for listening me carefully and patiently. And I hope so your child will get better within weeks. So, if you have any other concern, please let me know.
Okay. Okay. Thank you very much, Nurse. That's very nice. That's very nice. Thank you very much. I really appreciate your care and concern. Thank you once again. Have a nice day. Yeah. So that was a good session. You have improved a lot, Preeti Sahrawat. You have done very good job, and you have improved. But only the thing is, again, you are falling a little back, because earlier you gave everything into my hand, and you said, "Sir, however you tell, I will listen." But now again you have started restriction. Because of that one, you are falling back slowly, slowly, slowly. You are falling back. First thing is, I'll tell you why. Repetition is happening, not it's increasing now, as well as you spoke 4 times.
Mm.
Okay?
Thank you, sir.
It is missing from my control. You don't know what is happening. You are my child. You know that very clearly. Okay, like every other student, I love you also equally. So, what I'm telling you, be controlled regarding this one. As well as you told 4 times repetition.
Mm.
So, try to understand that one
Okay,
only
sir.
one I'm giving you. Earlier, you used to do 2 times, but now you have done
Mm.
4 times. That means slowly slipping out of my control. This is one example, wonderful example. So,
Mm.
be unlimited. Don't limit yourself for anything. I'm telling you, this is how it goes. When you start something, everything will be stopped. Progress will stop. Okay. Then confusion will start. All negative things will come up. So be bold, be brave, be unlimited, be unlimited version. Okay. Because if you stop now, everything will be stopped. So like that one, you are going to miss many other things. So like this one only. So listen to me. It is for your own good. Just to go ahead and be daring and dashing for anything. Okay. That's very nice.
Okay, sir.
Thank you very much for all the session. Now I'm going to take a short break, and then afterwards I'm going to start the lecture. So don't miss the lecture. It will be started. I'll send a new link to you.